be working with today, it has a right amputation of his upper extremity, and he has a traumatic brain injury. So we're just going to go through 3 objects and some exercises to help him out. So with his, he has his right amputation on his upper extremity. We're going to be working with bed mobility with a yoga mat. So what I did is I rolled up the yoga mat. I'm going to put it on the bed. So he has difficulty rotating to his right side. He doesn't want to put much pressure on his right side where he was amputated. So what we're going to do, put the yoga mat under the patient's left side of the back, under the scapula. And what you're going to cue the patient to do is rotate to the right. And you're going to tell the patient to rotate until they can't feel their back on the yoga mat anymore. So this is going to help with, again, cueing him to rotate more to that right side. You can also help increasing his core stability and his trunk strength. And so for the next exercise, he's going to be seated. This is a sitting exercise, and you're also going to use a yoga mat. So what you're going to do is you're going to roll up the yoga mat and place it where the curve of his back is. And he has difficulty with poor posture when sitting. So he kind of has a poor posture, increased kyphosis. He also has like a posterior pelvic tilt. So he's just going to sit like this. So what you want to cue him to do is to perform an anterior pelvic tilt. And you're going to tell him to perform that anterior pelvic tilt. You can help him in the beginning until he doesn't feel that roll on the back of his spine. So he's going to be sitting like this. He's going to have an increased pressure, feeling that yoga mat, and then you're doing some pelvic tilts anteriorly. I'm going to go like this, feeling it, and do an anterior pelvic tilt. So for this patient, he is supervision for sit to stands. He does sit to stands fairly well. So for this exercise, we're just going to do repetitions doing sit to stands and increase his quality of them, increase his safety, and also strengthening while doing this functional activity. So when using the yoga mat, again, we're going to have it rolled up so we can put it on the chair, and we're just going to have him performing some mini squats. So we're just going to have him go down until he feels the roll and come back up. So just performing these mini squats. And you can progress this by unraveling it. So he has to squat down farther. Squat, he has to go a little bit farther down, and then you can even fold it so that's even flatter. So he almost has to go all the way down to the chair. Then you can put it on the ground to decrease the friction of the floor, so you're going to be standing on it. So he's going to now be doing sit to stands. So he's going up, and then go back down, pushing up. And then you can also progress to have him standing, and then doing some ankle sways. Also with standing on that yoga mat, decreasing that friction. And then you can do step strategies and hip strategies with this patient after sit to stands. For the next exercise, we're going to be practicing standing balance with the patient. So the patient has difficulty with static and dynamic balancing. With the TBI, the patient also has difficulty dual tasking while performing an exercise and motor planning. So we're going to use the yoga mat again, and we're going to have the yoga mat halfway rolled up already so the patient can hold it in their hand. So what you're going to do is after that they perform narrow base support, tandem, you can progress to single leg stance. So they're going to stand here statically, and then after 10 seconds of doing that, if they can, start rolling up the yoga mat. So this is working on dynamic balance since you're moving and rolling up the yoga mat, and dual tasking. So for the next exercise for gait, you can work with him with the yoga mat. You can put it down since it's a nice like rectangle kind of pathway. You're going to have him walking along it so he can decrease his scissoring. He also, you can put down post-it notes, and you can have him walk to the post-it notes to kind of simulate a even step length. So you have him just walking to it, have him not perform his scissoring, and then you can walk back. So this will hopefully decrease his scissoring because he's got to walk to the post-it notes. He can't like walk sideways to the post-it notes. Increase helping his stride. The potential difficulties this patient may face while performing transfer activities with a yoga mat may be that the yoga mat may not stay rolled up in the chair, and they cannot perform the sit-to-stands and squats with the yoga mat in the chair. The patient has an inability to dual task and a lack of attention. So with performing the sit-to-stands with the addition of performing sways and ankle and hip and step-in strategy may be difficult for this patient. Also, the patient has decreased awareness, which results in balance and safety risk. When performing these balance activities, the patient may have muscle fatigue during these, limiting repetitive performing the sit-to-stands may cause decreased quality of the functional activity. For example, reverting back to the poor posture. So for the next object we'll be using is a mascara bottle. So we're going to start with bed mobility. So again, for bed mobility, he has decreased ability to go on his right side. So he doesn't want to put that pressure, he doesn't want to rotate all the way to his right side to perform a correct supine to sit. So we're going to have the therapist come in. The patient's going to be laying supine, and the therapist is going to put the mascara bottle at different angles and different distances. So the patient is going to rotate their body to pick up the mascara bottle. So a lovely therapist. So therapist is just going to put the mascara bottle, you're going to pick it up, or you're just going to touch it. Good. So this helps strengthen your core to perform bed mobility, and also when you go to the right side, increase his ability to rotate on his right side and get used to putting that pressure on his amputated side. For the next exercise, it's going to be a seated exercise while utilizing the mascara bottle. So the patient has a forward head flexion position while he is sitting. So he has that forward protrusion like a lot of people have. So to help him out with this, you can use a mascara bottle to cue him. So you're going to put this to his chin and have him retract his cervical spine. So perform a chin tuck. So go in. You can also have the patient put the mascara bottle under his chin, and you want to cue the person to touch the mascara bottle with their chin. So performing that cervical retraction, touching the mascara bottle with their chin again. Again, for transfers, this is the next exercise we're going to be performing with the patient. He again is pretty independent with transfers, just with some supervision. So you want to increase the repetitions he does to increase the quality, and also strengthen the upper extremities and the lower extremities while he's performing this sit-to-stand transfer. So when we use the mascara bottle, the patient's going to be sitting down. We can have the therapist come over and place the mascara bottle at different distances. So the first one, it can be sort of close, where the patient just has to go out of their base of support, picking up the mascara bottle, and just sitting back down. So you can do it again, same kind of distance, but at a different angle. And this is just initiating sit-to-stand. So the next one, it can be farther, so where the patient actually does have to perform a sit-to-stand, and using the ankle strategy to pick up the mascara bottle. So you can do it even a little bit farther, where the patient has to stand up, and then step strategy, and then come back, and then sit down. So for the next exercise, we will be working on balancing while standing. The patient has impaired dynamic balancing. So what we're going to do, we're going to utilize the mascara bottle again, and we're going to have the therapist move the mascara bottle at different angles, and the patient's going to follow it with their head or their arms. And the first part is you're going to have the patient in a narrow base of support. So you're just going to follow it with your head. And then you can transition the patient following it with their arm, just moving a little bit more. Good. And then you can also have, still while in narrow base of support, you can have the patient close their eyes, taking out the vision part of this, and just visualizing in their head where that mascara bottle would be, moving their arms again. You can do like flexion, you can do horizontal abduction with the patient, like 2 sets of 10 while doing this, or for so many seconds while the patient can hold that position. And then you can progress to having the patient doing a tandem stance, the right out in the front, the left out in front, so many seconds, and then increasing that seconds once they become comfortable with that. You can also have them performing single leg stance on either side, performing the head turns, arms, closing their eyes while utilizing the mascara bottle. And you can also, after that, do an AirX, narrow base of support, tandem, single leg stance, or you can also do it with other, like rocker boards with that, and while the therapist is still utilizing the mascara bottle as like a visual cue. So for the next exercise, we're going to be doing gait training with this patient. So this patient has impaired walking in straight lines, so they sway, they have increased base support, and they have increased kyphosis while they're standing and walking, so they have poor posture. So what you want to do with this patient, and they also have inability to dual task, to exercises and doing other things. So what you're going to do with the mascara bottle, you're going to have the patient just standing here in a good posture, and then in the beginning, they're just going to be balancing the mascara bottle on their shoulders. This initiates good posture for the patient, and then you're going to progress them to like walking with this. So the potential difficulties for this patient with standing activities with the mascara bottle is the patient has poor and impaired lower extremity coordination. This could be difficult when balancing in different positions for the patient or on different surfaces. Also, muscle fatigue could kick in while doing these repetitive balancing exercises with different positions and different surfaces. This may cause a decreased quality in the balance or their posture. Patient also has difficulty motor planning and information processing, which can make teaching him how to get into different positions to balance may be difficult for this patient. The patient has difficulty with attention to task, which could limit the ability of the therapist to teach him the different positions and have the patient's, it would be difficult for the patient to focus long enough to balance, for example, 20 seconds. Also, the patient has difficulty with static and dynamic balance, which could lengthen the processing for balancing longer on different surfaces and also different bases of support. So the last object we'll be utilizing with this patient is lace-up shoes. So to challenge him more, we placed cans in here to increase the weight. So for the first exercise of bed mobility, the patient is doing fairly well with bed mobility. So what we're going to do with this, we're just going to perform some crunches in bed to increase the core stability. So what we're going to do, lay on the bed and have the patient hold the shoes. And what you're going to do is you're going to have the patient crunch up, holding the shoe. And they can go out to the side to strengthen the obliques. And this will strengthen your core to initiate bed mobility. Okay, for the next exercise, we're going to be having utilizing the pair of lace-up shoes, sitting exercise. So the patient has poor posture and he's sitting in that posterior pelvic tilt. So we want to initiate good posture and more of the anterior pelvic tilt. So what we're going to do, we're going to be using the shoes as cueing for the patient. So we're going to put this, we're going to sit down, put the shoe where your lumbar kind of creases, and then you're going to put your shoe in between the scapulas. So you can have the therapist do this for the patient. So have the patient first form an anterior tilt. So the shoe is cueing the patient to form that anterior tilt, and then you're going to have the patient retract their scapulas to initiate that good posture. You can hold this for about 3 seconds and then relax. And you can do 2 sets of 10 doing this, the anterior pelvic tilt and the scapular retractions. So the next exercise you're going to be working with this patient is transfers. So utilizing the pair of shoes again, you're going to have the patient, you're going to have the shoes on the ground. So you're going to be sitting on the bed, and while he performs transfers from the bed to the chair, he performs a pivot stand, pivot transfer. So he just, again, utilizes supervision for this. So we're going to just repetitively do this to increase, again, his quality and his ability to perform this with balance and safety. So you're sitting on the edge of the bed. You're going to do a sit to stand. You're going to squat down, pick up the pair of shoes, and then you're going to pivot and then sit back down. And you're going to perform sit to stand again. Get his balance, squat down, put the shoes back down, then perform a pivot, and then sit back down. And you repetitively do this to increase his quality of the transfers. So for the next exercise we're going to be working with the patient is a standing balance exercise. The patient has impaired static and dynamic balancing. So for this exercise we're going to be working on his dynamic balancing. So you're going to put the pair of shoes down on the ground about shoulder width apart, and then you're just going to have them tapping towards the shoe, so on each foot. So you're simulating that single leg stance. So that is just going in front of you. You can also have the shoes to the side where they have to kind of go at a more of an angle and stepping to the side, improving that dynamic standing balance. So the last exercise we'll be working with this patient is working on gait training. So with a pair of shoes, you're going to tie the laces together, and it's going to be about shoulder width apart, and you're going to put them on the ground. So with the shoe laces tied together, it's a little bit of height above the ground. So what you're going to do to initiate gait, you're going to do more like a stepping strategy. So you're going to tap, you can tap, and to progress this, they can actually step over it and then come back. Step over it and come back. And they can progress to do a full step over and then come back. You can also have, to progress with gait, you can also have the shoes staggered. So we're going to have them staggered wide. So I don't know if you can see this on film.
Yeah.
So you're going to have the patient weave in and out of the shoes, forming like an obstacle. So you're having weaving. And then the next, you can place it closer together, so they have to do a sharper turn while they're weaving. The next thing you can do is have the shoes in their pathway, and they have to negotiate the obstacles. So you're walking, you're looking, walking, you have to walk over the shoes. So you can progress this as well. So you can perform this in the clinic. You can also perform this on different surfaces. We have wooden floors, so you can do wooden floors and carpet. You can progress this going outside. And then without the shoes, just later, you can have the patient ambulate in the community, weaving through people and negotiating different obstacles that come their way in the community. So the potential difficulties with a patient like this performing gait training with a pair of lace shoes is this patient has poor motor planning and lack of attention to task and dual tasking, making ambulating with steps and obstacles very difficult to perform once the patient becomes physically and mentally fatigued. Verbal cueing from the physical therapist will be required to aid in the patient in completing these tasks. Also, the patient's abnormal gait patterning with the scissoring and the swaying may cause some difficulty for the patient to perform those obstacles, like stepping over the shoelaces, stepping over the shoes while ambulating. This could be difficult. Also, again, muscle fatigue could kick in when doing these repetitive gait exercises. The patient can revert back to his old gait patterns or decrease posture, and this would increase the his center of mass could be altered, and this could increase his fall risk, which would not be good for this patient. Also, this patient has impaired depth perception, which could be difficult for patients locating and anticipating the location of the shoes while trying to step over the shoes, or different obstacles that the patients face during gait training.